In the last few years, it really feels like we're all drowning in a crisis of health misinformation. It seems like a problem that was custom built for our social media age, right? But the stakes, well, they're way higher than most of us probably think.
I mean, just let that sink in for a second. That's a quote from the head of the US Food and Drug Administration. He's framing this not as some online annoyance, but as the number one threat to our lives. It affects everything from whether people get vaccines to using unproven, dangerous treatments. It is, by definition, a public health emergency.
And there's actually a word for this feeling. The World Health Organization calls it an infodemic. It's that sense of being totally bombarded with information. Some of it's good, some of it's bad, a lot of it is just plain confusing, and it becomes almost impossible to figure out what's true. I think we've all lived through that.
But here's the big question, the one we're really digging into today. Is any of this actually new? Is misinformation this uniquely modern monster that was created by the internet? Or have we been fighting this exact same battle for centuries? Well, the answer might surprise you.
So we're going to take a trip back in time and look at 4 major pandemics to see if we can spot the patterns. Because it turns out, the story of fighting disease has always been a story of fighting bad information. Okay, let's rewind the clock way back to 1796. We've got Edward Jenner and the very first vaccine, this incredible discovery to fight smallpox. You'd think this would be a moment of pure celebration for humanity, right? Well, not so much. And what's absolutely wild is just how familiar these fears sound today. People were really uncomfortable that the vaccine came from an animal, from cowpox. Some religious leaders called it unholy. Even other scientists were skeptical because, frankly, Jenner couldn't perfectly explain how it worked. And in places that were colonized, people saw it as just another tool of oppression, which fueled this really deep-seated distrust. This panic went viral. Not on the internet, obviously, but through things like this cartoon. This wasn't just some funny drawing. It tapped into a very real, very widespread fear that the vaccine would literally turn you into a cow-human hybrid. This was the viral meme of its day, and it spread fear way faster than any newspaper article. All right, let's jump forward to the 1800s and cholera. Now, here the problem wasn't just public fear. The problem is that the scientists themselves couldn't agree on how the disease was spreading. So you had 2 competing camps. On one side, you had the miasmatic theory. This was the dominant idea for ages, that disease spreads through bad air or foul smells. But on the other side, you had this doctor, John Snow, arguing, no, 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 it's in the water. And when your experts can't agree, it creates this huge information vacuum. And you know what rushes in to fill a vacuum? Panic and misinformation. And here's a really fascinating twist. That heroic story we all learn in school about how Jon Snow dramatically removes the pump handle and single-handedly stops the outbreak, it's kind of a myth. It's its own form of misinformation. The historical data shows the outbreak was already fading by then. It's a great story, but it's not quite the truth. Okay. Next up, 1918. The massive influenza pandemic hits during the final year of World War I. And this created an absolute perfect storm, where the demands of the war effort went head-to-head with the needs of public health. I mean, does any of this sound familiar? You had different health officials giving conflicting advice on wearing masks. To keep wartime morale high, governments literally censored the news about how bad the flu was. They created what we now call information voids. And that lack of good information didn't calm people down. It did the opposite. It fueled panic and made everyone vulnerable to rumors. Some officials even told people it was unpatriotic to get sick. For our final case, we land in the 1980s with the HIV/AIDS crisis. And this one shows us what happens when misinformation gets tangled up with social stigma. The result is a truly devastating, long-lasting public health disaster. From the very beginning, this disease was wrongly labeled and tied to specific groups of people. That first terrible, inaccurate name, gay-related immune deficiency, and the idea of the 4-H, that created a stigma that was incredibly powerful. And it wasn't just hurtful, it was deadly. It made people outside those groups think they weren't at risk, and it created this legacy of fear and distrust that to this day can make people hesitant to get tested. So after looking at all 4 of these historical moments, a new picture starts to emerge. You see the same patterns again and again, and it makes you wonder, what if we've been looking at this all wrong?
What if the fake news and the viral memes? What if they aren't the disease? What if they're just the symptoms of something much deeper?
If that's true, it means we have to stop playing whack-a-mole, trying to debunk every single bad story we see. Instead, we have to zoom out and look at the entire information ecosystem. That's the whole environment, the social pressures, the politics, the levels of trust, all the stuff that determines whether good, solid information can grow or if misinformation is going to take over. And history shows us exactly where the weak spots in that ecosystem are. It's things like information voids, where there's just no credible source to turn to. It's low public trust in institutions, which is often earned over decades. It's the powerful, destructive force of social stigma. And it's political agendas that try to bend science for their own gain. Misinformation is what grows in the cracks that these failures create. So, if that's the diagnosis, what's the prescription? How do we actually build a healthier, more resilient information ecosystem? Well, the whole focus has to shift from just debunking lies to actually building trust. And the solution starts on the ground, working with communities, not just talking at them. It means being radically transparent, being honest, and admitting when science doesn't have all the answers yet. That honesty is what builds real trust. And maybe most importantly, it means empowering the most credible messengers we have. So who are those messengers? Well, study after study after study points to the same people. It's our doctors, our nurses, our local healthcare providers. That personal relationship, that one-on-one connection built on trust, has always been the single most powerful tool in the fight for good information. So, at the end of the day, the real takeaway isn't that misinformation is new. It's that the solution is timeless. Misinformation is like a parasite. It can only survive and spread in an environment of distrust. So the only way to truly inoculate ourselves against it is to build up those strong relationships and deep reserves of trust before the next crisis hits. The real question is, are we ready to start building?